To imagine what it's like facing the coronavirus on the front lines.
As KPIX 5 Devin Fehely reports, the emotional toll on healthcare workers could linger long after the pandemic ends.
That's what I would want to see, that we learn from the lessons of the past and we prevent that kind of suffering moving forward.
Dr. Shaili Jain says she's concerned not only about the physical well-being, but the emotional and mental health of people, nurses, doctors, paramedics, and others on the front lines of the battle against coronavirus.
Of course, you're going to be there for your patients, you're going to take care of your patients, you're going to do your job, but does it mean at the risk of me getting sick or me making my loved ones sick? I think that quandary is something that healthcare professionals, certainly in this country, are not used to dealing with day by day.
Dr. Jain says research and past experience strongly suggests that caring for gravely ill and dying patients will take a toll. The symptoms of that emotional trauma manifesting days and possibly weeks and months after the outbreak itself.
If you're in the thick of it, if you're losing people every day, if you're seeing your colleagues get sick, that in itself, that intensity of exposure is what's going to make you put you at risk for psychological consequences in the aftermath.
Dr. Jain says frontline workers should look for signs of emotional distress, sleeplessness, irritability, depression in themselves and others. And if the symptoms persist, get help.
And the way healthcare professionals operate, they're trained to carry on and defer. In the moment they do what needs to be done, they hyper-focus, they hyper-concentrate, but then they defer the psychological and the emotional processing till later. I think what's important to know is you need to do that piece of it.
Devin Fehely, KPIX 5.